Okay, so first thing we start off with is we're going to wash our hands and then put our gloves on. Okay, so that's the first step. Our second step is identifying our patient. So you can make up a name. First, last name, and your date of birth.
Stacy Adams, 5/14/85.
Perfect. All right. All right. So what I'm here today for is to draw your blood. Is that okay with you today?
Yes.
Okay, perfect. So, and then it says to put your gloves on next, but I don't touch patients without my gloves on. So the next part we're going to do is we are going to, let's see. Okay, so we want to select the best equipment for the procedure that we're doing. So whether it's a butterfly stick or we are going to be doing a regular venipuncture like this, you want to make sure you have it not set up until you are in front of your patient, because they need to see that this is all new stuff. Just like getting a tattoo, you don't want them to set it up before you get there because you never know where that's been. Okay, so and then we are gonna do that. Then we assemble our equipment. And then the next part is we're gonna palpate for our vein, okay? All right. All right, we have a good one going right that way. Okay, so this general area is where you guys are going to be drawing blood. Okay, so if you feel it a little bit further down in this area, that's still an okay place to go. If you, like right here, she has her medial vein going kind of off a little bit to the right, but it's still in the middle. So this would be the best option whenever you're actually going to be drawing blood. You don't want to go too far past the medial vein unless, like, obviously the patient is like a really hard stick, then you start looking in the other areas, but the median vein is the perfect space. So, and you also want to always line yourself up with whichever direction the vein is going. So this vein is going this way, that's why I'm kind of starting to turn my whole body in that direction. Okay. All right, perfect. Okay, so we're going to untie that. We don't want to leave that on. Going into the venipuncture, you want to let the blood come back, and we don't want the analytes to be raised also, okay? So, next step is going to be cleaning our area. Okay, we're going to clean the area. And concentric circles, never touching the same spot twice, from the middle outward, okay? Then we're going to go ahead and we're going to retie this. Make sure all of your equipment is within your reach, okay? You don't want to be crossing over or doing anything weird like that. It can hurt somebody, okay? So never retouching the same area, okay? If you do touch it, you got to clean it, restart over. Let it dry all the way. Never let it be wet, because that can also mess with your results, okay? All right, so then we're gonna check for any inclusions, making sure that there's nothing on there, making sure that there's no jagged edges. That's just a double precaution, okay? And then we're gonna anchor. We're gonna angle our vein at only 15 to 30 degrees. You don't wanna go any more than that. Okay, we're in. Always doing the light blue first, okay? And filling it all the way up. If you want to get closer, you guys can come and see. And once it fills up, you're gonna remove, and it should just pop right off, okay? When you go in, you're gonna grab the back of the phalanges and you're gonna push with your thumb and push it in, okay? And then with that same part, you're going to push with your pointer finger and grab with your thumb and middle finger and pull that out, okay? But it's tourniquet, tube. Then we're going to do the gauze. Don't push down till this is out. We're activating our safety. Go ahead and hold that for me. Always ask the patient to hold it for you, especially in an outpatient setting. They're going to try to run, okay? You don't want them to do that yet. You want their blood to clot and everything to stop, okay? We're throwing this into our sharps container immediately. We're inverting our tubes 5 to 8 times, okay? We're not shaking them, we're just gently inverting them, okay? Next thing we're doing is first name, last name, date of birth, your initials, military time, and if you actually have to put the date of the actual draw, okay? Then we're gonna go ahead and take a look. We wanna double check and make sure that they're not bleeding and that everything is starting to do what it needs to and stop. Then she's good to go, so we're gonna tape her up. And some people prefer Coban, other people don't mind the tape. I just use tape, it's much quicker, to be honest with you guys, okay? So she's good to go. And then you clean up your supplies, you throw them in the correct areas, and then you tell the patient, thank you, have a nice day. And that is it, okay? So, do you guys have any questions?